This is news analysis coming to you live on Politics and Business Television Abuja. Good afternoon and many thanks for joining us. I am Omike Joseph Matthew. The headlines: Kogi shuts markets, motor parks to flush out terrorists. Bauchi governor sacks commissioner for internal security. Nigerian Senate summons emergency plenary amid looming protests. And on the foreign scene, Hong Kong jails pro-democracy media tycoon Jimmy Lai for 20 years. Details of the stories after the break. Do stay with us. Thank you very much for staying tuned. And the news now in detail. The Kogi state government has ordered the temporary closure of selected markets and motor parks across the state as part of intensified security operations aimed at flushing out terrorists, bandits, and other criminal elements. The decision was announced in a statement issued on Sunday, on the 8th of February 2026, by the Commissioner for Information, Kingsley Fanwo. According to the statement, the closure affects selected markets and motor parks in parts of Kogi West Senatorial District and adjoining areas as security agencies intensify coordinated clearance operations. Fanwo said the move was designed to disrupt criminal logistics by restricting movement and cutting off access to food supplies, consumables, and other forms of support used by terrorists and their informants. He explained that the operation were being carried out in collaboration with the Office of the National Security Advisor and heads of security agencies in the state. The directive affects communities across 7 local government areas of the state. And still on security matters, the Bauchi State Governor Bala Mohammed has removed the Commissioner for Internal Security and Home Affairs Alhaji Ibrahim Gambo Galadima from office with immediate effect. The development was announced in a brief statement signed by the Special Advisor on Media and Publicity to the Governor, Comrade Mukhtar Gidado, and released to journalists in the early hours of Monday. According to the statement, the governor approved a minor reshuffle of the State Executive Council, which resulted in Galadima's disengagement. Hidado explained that the decision aligns with the administration's policy of periodically reviewing its cabinet. Thank you. You're still watching the business at the Politics and Business Television Abuja. The Senate has announced that it will reconvene an emergency plenary sitting on Tuesday, the 9th of February 2026, following growing public outrage over the recent passage of the Electoral Act Amendment Bill, particularly the removal of a provision mandating real-time electronic transmission of election results. The development was disclosed on Sunday in a statement signed by the Clerk of the Senate, Emmanuel Odo, directing all senators to attend the session scheduled to commence at 12 noon. The emergency sitting comes amid escalating reactions from organized labor and civil society groups. The Nigerian Labour Congress has warned of possible nationwide protest and election boycotts, accusing the Senate of creating confusion through what it described as contradictory positions on the Electoral Act amendment, especially on the issue of electronic transmission of results. Similarly, a new formed coalition of political activists operating under the banner of the Movement for Credible Elections condemned the National Assembly's decision to exclude mandatory electronic transmission from the proposed Electoral Act Amendment Bill 2026. The group described the move as a deliberate attempt to undermine democracy and erode public confidence in Nigeria's electoral process. You're still watching the news analysis right here on Politics and Business Television, Abuja. And still to come, Obi leads protesters to National Assembly over real-time transmission of election results. Details of these and more after the break. Do stay with us. Welcome back. Peter Obi, leading presidential hopeful for the 2027 elections, has led protesters to the National Assembly. The politician, who is joined by many of his supporters, including Aisha Yusufu, a popular activist, is currently at the entrance to the parliamentary building. The protesters stormed the area to demand approval of real-time electronic transmission of results from polling units in the Electoral Amendment Bill under consideration. The security forces, comprising mainly of the police with Nigerian Security and Civil Defense Corps, as well as other paramilitary agencies, stationed their vans around as their man-manned strategic locations to ensure order. And now to the world of business. Imported premium motor spirit is 77 naira cheaper than Dangote Refinery's petrol, according to the latest figures from the Major Energies Marketers Association of Nigeria. Miman data on Friday showed that the landing cost of petrol stood at an average of 721.80 kobo per litre. On the flip side, the Dangote Refinery petrol gantry price stood at 799 per litre. This showed a 77 naira 2 kobo per litre price gap between imported fuel and Dangote Refinery. Meanwhile, last week in a statement, the 650,000 barrel per day refinery said that marketers will save at least 77 naira per litre if they patronize its gantry price petrol over cost delivery. And to the foreign scene, a court in Hong Kong has sentenced pro-democracy media owner Jimmy Lai to 20 years in prison under China's national security law, a decision that has drawn a strong criticism from press freedom and human rights groups. The ruling, delivered on Monday, brings to an end Hong Kong's most prominent national security trial, which has lasted nearly 5 years. Lai, 78, is the founder of the now defunct Apple Day newspaper. He was first arrested in August 2020 and was convicted late last year on charges of colluding with foreign forces and publishing seditious materials. The court said the offenses were serious and placed the sentence within the highest punishment range under the law. In delivering the judgment, the court described Lai as a key figure behind the alleged activities, a factor that influenced the length of the sentence. Lai, who also holds British citizenship, has denied all the charges, insisting that he is a political prisoner and a victim of persecution by Beijing. And now, let's go to the world of sports.
Good day and welcome to PRB Sport News Updates. I'm Abel Sunday. Liverpool title hopes took a hit last night as Manchester City edged the Red 2-1 in a thrilling clash, tightening Pep Guardiola's grip at the top and sending a strong statement to the league leaders. At Old Trafford, the revival continues. Manchester United delivered a composed 2-0 victory over Tottenham, showing confidence, control, and growing belief as their impressive run rolls on. That's all for sports today. I'm Abel Sunday.
that's the sports day by Abel Sunday. Thank you very much. So, welcome to our focus today on politics and business television. Today, we turn our attention to the commemoration of World Cancer Day, observed every 4th of February. On this program, we will examine how Nigeria has progressed in its fight against cancer and the measures put in place so far to prevent, detect, and manage the disease. To help us better understand this very important topic, we will be joined by a medical expert who will break down the facts, challenges, and solutions surrounding cancer care in Nigeria. Do stay with us. Right, welcome back to the Politics and Business Television, and of course, it is time for the focus. Now, today we pause to observe World Cancer Day 2026, a day not just marked on the calendar, but etched in the lives of millions of families across the world. Cancer is not just a medical condition; it is deeply human story of pain, courage, hope, and resilience. So, World Cancer Day is observed annually on February 4 and was established in the year 2000 at the World Summit Against Cancer for the Millennium in Paris. The initiative was led by the Union for International Cancer Control with a clear purpose to unite the world in the fight against cancer through awareness, advocacy, and collective action since its inception. The day has grown into a truly global movement, bringing together governments, healthcare institutions, researchers, patients, and communities. Cancer remains one of the leading causes of morbidity and mortality worldwide, affecting billions of lives every year. World Cancer Day exists to remind the global community that many cancers are preventable and that early detection, timely diagnosis, and equitable access to care can save lives. So, beyond statistics, the day highlights the human stories behind the disease and reinforces the need to address disparities in cancer prevention and treatment across regions and populations. So, this year's theme is United by Unique. So, joining me this day to discuss this very important topic is Dr. Ayuba Hanatu Usman. She's, of course, a consultant, radiation and clinical oncologist at the National Hospital here in Abuja. A warm welcome to the program. Thank you very, very much. And of course, I will begin the very first, question to mark this day with this. How alarming is the statistics of cancer patients in Nigeria?
The data we have presently shows that we have 127,000 thereabout patients with mortality that is more than half of what we have. And this, we agree that this may even be limited data. It may even be more than that. So for the alarmingness, I see these statistics beyond just numbers. When you look at the families, the communities that are disrupted, families, the family dynamics that are stretched, the work opportunities that are affected by this disease, cancer, it's much more than what we see as statistics. When you look at that human face, when you give cancer, you look at that human face to the problem, then you understand that we have a bigger problem at hand.
Wow. Okay, so can you give us an update on government measures so far, taken?
There has been a lot of improvements and milestones that have been reached. When you look at the health systems, the way the health systems work, in health system strengthening, we always look at the different composite blocks that create the health system, and that health system is what always is in dynamism to sort out whatever problems we have in the health sector. When you look at governance in Nigeria, there has been a lot that's happened on that governance for cancer care. We have the Federal Ministry of Health, which has the National Cancer Control Plan, and they are continually working to bring out policies, to implement these policies. We have the NICRAT. NICRAT is also there to oversee research and training activities. Then we look at even our cancer registration. Our cancer registration has gone through a lot of metamorphosis. There has been partnerships with different agencies. St. Jude, we have the CanReg registration that has been updated by NICRAT, and they are continuously increasing that capacity building amongst all hospitals in the country, especially tertiary facilities. Then when you look at the research part of under cancer care, NICRAT has really supported capacity building. I myself am one of the beneficiaries of their SINCA program, in which they, as much as possible, are continually increasing the capacity of cancer researchers in the country. Then you look at the treatment itself, radiotherapy availability. We know that we have a huge unmet need. However, but recently during the World Cancer Day celebration by NICRAT, commemoration by NICRAT and the Ministry of Health, we were happy to hear the Honorable Minister, Dr. Isiaq Adekunle Salako, talk about the radiotherapy machines that are going to be brought to about 8 centers. Okay. We already even have the preventive oncology clinics that have now been installed in all the geopolitical zones. Ours in Abuja will be at the FMC Jabi, and it was recently launched on the 4th. When you look at all these different system blocks and all the improvements that are happening in the cancer care landscape, we are grateful and we are happy that such is happening. However, we don't mind more, because when you look at the healthcare financing sector, the government has tried, they are trying. However, we are still hoping and pleading that the budget is able to see to our patients' needs. The National Cancer Health Fund brought a lot of succor to patients. However, it had a limit. Only those cancers that were covered, and then access was a bit of a challenge. But now the minister has told us that they are looking at a more sustainable way to finance cancer care, and this is going to be under the health insurance aspect. Okay. So we are hopeful for that. I'm also a member of the Governing Council of the National Cancer Intervention Fund. We are also looking at ways to raise support for our patients to be able to intervene for all the cancers, not just breast, cervical, and prostate. And presently, we are also working on some meetings to look at resource mobilization, utilization, and even transparency. How we're going to have a software that as donations are made, people are seeing what is happening, and then how these things are dissipated to the different facilities. We are also encouraging all these benefits to go down to the grassroots, and that's why we're encouraging innovation. We're encouraging any program that will not just end in the cities, Abuja and Lagos. We're looking at those things that will trickle down to the communities where the bottom, where the billions reside.
All right. Now you talked about the grassroots, and as a common man, maybe watching us right now, may not know the kind of or the types of cancer we actually have. Okay, we'll be going for a quick break before Okay. So when we return, we'll surely talk more. So we'll be right back in a moment. All right, you welcome back. And in the studio here, I have Dr. Ayuba Hanatu Usman, who, of course, is a medical expert and expert on cancer prevention in Nigeria. Now, well, before we quickly, wrap up the program, is the fight against cancer yielding the desired result in Nigeria? I know you've talked a lot about the support that you're already getting from the government as medical expert, but is it really yielding results in the country?
Well, that is a very big question because when you look at all the different areas I talked about in the health system, when you're looking at governance, healthcare financing, service delivery, and even healthcare workforce, when you look at all these different systems, it's a very big question you've asked. However, we at the hospital, we see our cancer patients, we speak with them, we get feedback from our patients that have to travel kilometers to come for certain treatments. I would say, in my personal opinion, that there's a lot to be done. So much has been done, but there's a lot to be done.
There's still lots to be done.
Yes,
All right.
yes. And we are hopeful that with all these milestones we're beginning to have, like the preventive oncology clinics we never had before, and then even the healthcare training, cervical cancer elimination, the National Task Force for Cervical Cancer Elimination, we're having so many good things that we are believing are beginning to yield fruit.
Okay.
However, there's a lot that we really need to work on.
Thank you very much, Dr. Ayuba Hanatu Usman, for coming on the program today. We really appreciate you.
Thank you, sir.
Dr. Ayuba Hanatu Usman is, of course, a consultant, radiation and clinical oncologist at the National Hospital here in Abuja, and, of course, the CEO Cancer Consciousness Initiative also. And she's a member of Governing Council of the National Cancer Intervention Fund, like we heard from her earlier. Thank you very much once more. And of course, and that wraps up today's program. But before we go, the headlines once more. Kogi Shots markets motor parks to flush out terrorists. And you heard in the news that Bauchi, a governor, sacks commissioner for internal security. The Nigerian Senate summons emergency plenary amid looming protests. And from the foreign scene, Hong Kong jails pro-democracy media tycoon Jimmy Lai for 20 years. For more updates and in-depth analysis, follow Politics and Business TV English on YouTube and Facebook. Connect with us on Instagram at PMBTV_English and TikTok at PMBTV_English. And don't forget to subscribe to our YouTube channel also and be informed as always. From me, Omike Joseph Matthew, it's bye for now.